Part 7. The Invisible Layer, Administration. Most people experience healthcare through exam rooms, waiting areas, and conversations with clinicians. What they don't see is the layer that sits between care and payment, the administrative machinery that keeps the system running. This layer is largely invisible to patients, but it shapes cost, access, and workload in ways that are hard to overstate. What administration actually means healthcare administration isn't a single office or department. It's a web of functions required to make modern healthcare operable. Billing and coding, insurance verification, compliance with federal and state regulations, documentation requirements, quality reporting, audit preparation, contract management. None of these activities deliver care directly, but nearly all are mandatory. Why? So much paperwork exists. Healthcare is one of the most regulated industries in the country, and for understandable reasons. Safety, fraud prevention, privacy, and accountability all matter. Over time, however, layers of rules, reporting requirements, and payer-specific processes have accumulated, often without coordination. The result is a system where the same information is entered multiple times. Different insurers require different formats. Documentation is written for billing as much as for care. This complexity doesn't disappear just because patients don't see it. The staffing reality, most people don't know. It's common for a single physician to require multiple non-clinical staff members to support their work. These roles may include billing specialists, coding experts, authorization coordinators, compliance staff, administrative support. This isn't inefficiency in the casual sense, it's the operational cost of navigating a fragmented system. How this affects the exam room. Administrative demands shape clinical care indirectly. Less time per patient, more time spent on documentation. Delays caused by approvals and verifications. Burnout among clinicians who train to practice medicine, not paperwork. Patients feel the effects even if they never see the cause. A quiet but important point. When healthcare costs rise, it's tempting to assume the increase comes from tests, treatments, or clinician salaries. Often, it doesn't. A significant share of growth occurs outside the exam room, in the systems required to document, justify, process, and pay for care. That reality doesn't assign blame, but it does challenge assumptions. In the final post of this week, we'll step back and look at the system from the patient's perspective, what people are implicitly expected to know, but are almost never taught when navigating healthcare.